Hello, good afternoon. Welcome to the webinar. I'm Dr. Hal Danzer, one of the co-founders of Southern California Reproductive Center. We've been here for 25 years. We are grateful to be the most experienced fertility program in Los Angeles. I'm joined with Dr. Carolyn Alexander, and we're going to talk about sexual health and how it affects fertility. And it's one of those areas that is really important to understand how it may exacerbate or even create problems with infertility. And there's a number of things, topics we'll bring up. And I'm going to hand it over to Dr. Alexander.
Dr. Alexander, you're muted.
Hello, everybody. Hi, Dr. Dancer. I know
Hi,
you
how are
down the
you?
hall. Nice to see you. Elbow bump, handshake, all the
Happy
things.
Wednesday. Here we are.
Here we are. I'm from Los Angeles. I hope everybody's having a good day. I went to UCLA and then I got training in Baltimore at Johns Hopkins, and then I came back to work at Cedars-Sinai for almost 8 years, and then I've been with Dr. Danzer partners for the last 11 years. I'm so excited. This is an important topic. I think it comes up a lot during our discussions, and so I'm happy to make awareness of it. And next slide. Dr. Danzer, you're
I think maybe we do that.
after. Okay, next slide. So like Dr. Danzer mentioned, we have more than 25 years of experience here. Our lab was one of the first labs to do pre-implantation genetic testing for monogenic disorders. And we have our embryology lab here in Beverly Hills, as well as a sister facility lab in Santa Barbara, which is a full state-of-the-art embryology lab. We have outside offices for monitoring in Pasadena and Ventura. And our team works really hard to provide the best individualized care. Next slide. What sets us apart, we have very experienced and certified embryology team members, double witnessing system, vitrification, which is flash freezing. We do blastocyst biopsy for PGTA, which is aneuploidy screening, and PGTM for specific genes. We also do 24 chromosome genetic testing, as well as sex selection. Our lab has an embryo score, which is morphokinetics. It's called time-lapse morphokinetics, and it gives us a lot of data about each embryo, and it helps us evolve and improve to get the best quality embryo for you and your family building goals. Next slide. In terms of today, we're going to talk about the importance of sexual health and fertility, patient evaluations and testing, fertility treatments, and you'll meet our team. And any questions, a lot of patients put questions in the chat. We're happy to think them through together. Next slide. Next slide. Yeah. Okay. So in terms of sexual health and its importance, it's a state of physiological, endocrine, and reproductive system integrity that enables safe sexual function, normal fertility potential in the absence of sexual dysfunction, infection, or disease, while supporting psychological and relational well-being.
That's a big sentence.
That was like a twist to talk so long, but in terms of when I've given talks to some college students at their sororities and talked about fertility protection, I think the most common thing we think of in sexual transmitted diseases is chlamydia as well as gonorrhea, but lately now we're looking into urea plasma and mycoplasma as well, but also in terms of orgasm, when men are having sexual dysfunction. We just recently caught a patient with a high prolactin and a macroadenoma in his pituitary. So with erectile dysfunction or else women having delayed orgasm as well, it's not always just in our mind or psychological. It can be due to thyroid dysfunction, prolactin elevation. Low ovarian reserve can affect low estrogen, which can make some thin skin of the vagina or vaginal atrophy, which can make us not want to have intimacy if there's a concern that lubrication isn't like it used to be. And so there's a lot of different pieces. We do try to understand and tune in when we talk to each patient and or couple about their care. Same-sex couples as well, where we're talking about what can we do to help improve sexual function and well-being. We want to ensure access to care, information, and understanding. We work closely as well with many different psychologists in the area, and we have some physical therapy for the pelvic floor, because the muscles that hold up the vagina, I call it the hammock, can sometimes get into a spasm, just like we can get a Charlie horse in our leg when we're swimming or things like that. And sometimes that discomfort can be pretty profound. And so it's not, it's an anatomical issue. It's not just in our mind kind of an issue. So I think it's important to think of pelvic physical therapy as well. And sex therapy is also, we have some reliable resources for people as well for specific issues and situations. Anything you want to add, Dr. Danzer?
Yeah, I think I'll cover some things about the male, but it's very closely intertwined with the diagnosis and treatment infertility. And it's difficult for couples to talk about sexual issues. Um, Again, we as physicians help to try to draw that out, because that's a very important issue just in their daily lives, not only because of fertility issues, but if we can do anything to help that discourse start, it's really helpful for the couple. Absolutely.
Next slide. Yeah. So like we mentioned with sexual health, that can impact fertility. Sometimes untreated STDs when we were in college or younger years can lead to an impact on the fallopian tubes and can cause tubal factor infertility. If you know you had pelvic inflammatory disease, then that can really impact inflammation in the pelvis and can affect the fallopian tube peristalsis or ability of the egg and sperm to combine. As we mentioned, erectile dysfunction is pretty common. We see that a lot here and we talk about it, and we have an open heart-to-heart discussion with the partner and try to check their morning labs for total and free testosterone, FSH, LH, prolactin, thyroid, estradiol, and we make sure they got a physical exam, because sometimes there can be issues in the testicles or in the pituitary gland, which is the master control gland of the system. And so sometimes it can be an impact of medications. Some depression medications can cause erectile dysfunction as well. Sometimes if patients have uncontrolled diabetes, they can get erectile dysfunction and retrograde ejaculation, where the ejaculate comes out with seminal vesicle fluid, but actually the sperm goes into the bladder, which is always a little bit confusing to explain to patients, but it's an important thing that we do catch every once in a while. And so we have to make the patient urinate, take a medication, and then ejaculate, and then we look in the urine as well for sperm. Varicocele is a vein that occurs at the veins of the testicle, and it can lower testosterone. It can cause some discomfort or heaviness. So the patients will say, I always, exercise, but I noticed this sort of ache or heaviness in the testicle, and that can impact hormones for men, and it can impact sperm quality. We do notice the sperm DNA fragmentation to be abnormal if the varicocele is large. And it's important if your partner is getting a testicular ultrasound, that they do the ultrasound sitting, standing, and laying, because sometimes the varicocele is not seen if the guy is laying flat on the table. Hormone imbalances can occur both for the male and the female, and so that can impact sexual health. I noticed if our estrogen's really low as women, the desire as well as the ability to have an orgasm can change, or the caliber of the orgasm can change. In men, total and free testosterone, if it's very low, can impact their libido, their sense of well-being, their muscles. Some men, a signal is the gynecomastia or enlargement of the breast in men. Sometimes that's a signal that there could be estrogen on board, and that can also be due to other causes for men. So it's a whole picture of your health. Sleep disturbances in men and women can impact sexual health and libido as well. And so it's a very important thing. That's why I feel like I say it all day. Make sure to have good sleep. Make sure to get your annual physical exam with your primary care doctor. It's important to check your hormone levels. In men, we have to check them in the morning. They're more reliable in the morning. Next slide. In terms of chlamydia and gonorrhea, it can damage the fallopian tubes, leading to blocked fallopian tubes or pelvic inflammatory disease. Hormonal imbalances can impact the ability of the egg to release from the follicle, which is the shell for the egg. And sometimes if we're really stressed or we're flying a long flight or sleep disturbances, the LH surge that allows the egg to avulse and come out of the follicle can get hindered. In addition, if we have high testosterone as women from the ovary or the adrenal gland, that can hinder the ability of ovulation to occur and hinder the LH surge. In regular screenings and preventative care like your pap smear, STD tests, gynecological checkups can protect your fertility and overall reproductive health. Next slide. In terms of STIs, bacterial STIs can cause inflammation or scarring. STIs can be also associated with men in their epididymis. It can cause epididymitis. And so if we see many white blood cells on the original semen analysis, we automatically order a sperm culture, and sometimes we'll catch Proteus mirabilis, sometimes we'll catch Enterococcus or a unique type of bacteria that could happen, and that can be in the system. And so then we would treat both partners to get rid of that, and it does work really well, and then the sperm count, motility, morphology can improve. Untreated infections like gonorrhea can cause ejaculation, interfere with ejaculation if the urethra is scarred or obstructed as well. Next slide. HIV positive intended parents, we do have, we see patients with this, and so it's important to have advanced PCR screening, and we do send the sperm for a specific type of leukocyte wash to make sure to protect the system and protect the couple from if the male has HIV and the female's negative, or if depending on the circumstance, if we're using a surrogate, we talk about ways to protect spreading the HIV as well. We do personalized consultations, counseling. We support you every step of the way. We think it through. We talk to our embryology team, and we work together as a united team to help optimize so that we can keep everybody successfully happy and healthy. Next slide. Improving sexual health. So important habits are regular exercise, nutrition, good night's sleep, think about acupuncture, yoga to lower your cortisol. I feel like lately traffic's been so hard that I joke with patients, like just trying to get here, sometimes cortisol can rise. So you have to find ways to take box breathing and deep breathing and everything like that. In terms of important safe sex tips, condoms, limiting partners, think about the HPV vaccine. Most people who thought about it got it when earlier in time. There also is important to look at, smoking and alcohol. Alcohol in excess, like binge drinking, can impact our health overall, as well as in men can increase estrogen. So then that affects testosterone. We're seeing a pretty frequent vaping, especially in our male partners. And so vaping can be nicotine or THC. And so we have to talk a lot about trying to decrease that. I always say it's like preparing for the Olympics when we're getting ready for pregnancy. We want to really get as healthy as we can be. It's also healthy for your overall health and life longevity to avoid excess of alcohol, tobacco, marijuana, and caffeine. Next slide. Okay, when to see a physician, persistent pain or discomfort during sex, or an impact on your libido as well. Difficulty conceiving after 6 to 12 months, depending on your age, or if you have a family history of early menopause in your mom or sister or aunt, it's good to get a checkup quicker. Signs of infection or STDs such as vaginal discharge, sores on the penis, on the shaft of the penis, or any sores on the vulva of the woman. Irritation, some people say a burning sensation. It's important to get a checkup with your doctor. Regular checkups to protect your future with your pap smears, mammogram if you're at the time and age point for that, as well as your annual physical exam with your primary care doctor. Next slide. What is infertility? So under age 35, it's trying to conceive for 1 year of unprotected intercourse with regular menstrual cycles. After age 35 with regular periods, if you've been trying for 6 months, that is hitting the definition of infertility. And what's sort of mind-boggling is that when we're in our 20s, the chance of getting pregnant per month is around 24% per try. And as time marches on, it goes down. And so when patients come in, our average age of patients that Dr. Danzer and I see is 39.9. And so a lot of the patients are in their mid 30s, but also older into the 40s or 50s. And so we're talking to a lot of different patients about their specific case and trying to understand what to do. Next slide. In terms of the medical history, we want to understand if you have asthma, thyroid issues, how puberty went, were you on the birth control pill, did you have an IUD? We have a lot of important questions. We do a physical exam. We just caught a patient with an unusual mole and we told her to get it checked and it was actually almost a melanoma. So it's important to get a full physical exam, as well as a diagnostic testing for your ovarian reserve health, your semen analysis, the fallopian tubes, and to understand the uterine cavity to carry the pregnancy. Next slide. In terms of testing, a lot of people ask us, what is AMH? It's anti-Müllerian hormone level. It can be done any day, anytime. It's produced by the granulosa cells, which are the cells around the small potential eggs that are in the ovaries. And AMH, depending on your age, there's certain ranges. It's not a perfect test. It's just a tool in addition to your age and your other tests, including ultrasound and ovarian reserve tests that we look at FSH and estradiol on your second, third, or fourth day of your period. And these are the ranges of AMH that we like to see. And a lot of people say, doctor, what are we going to do? My AMH is lower than we predicted. I say, don't worry. There's always a good egg. We have to think it through. Let's see what we can do. Dr. Danzer's a whiz at helping patients with low AMH and what to empower themselves to get the best outcome. And he's going to talk a bit about treatment. Next slide. Do you want to do this one, Dr. Danzer? I think this is your part.
Right, right. So, the male testing really kind of revolves around, we start with the semen analysis, and then look at the volume, and the concentration is important. You like to have 20 million sperm in a CC, and then you want to have about 50% of the sperm mobile. And that's important because sperm that isn't swimming is probably not viable. And then you look at the shape of the sperm, and you look off to the right there. Normal is about 20% of the sperm. The other 80% are abnormal forms. And that's why I have millions of sperm. And again, the sperm can't see the egg. And that's why the motility is so important, because a very motile sperm will cover a lot of territory and essentially has to bump into the egg. And then it has to burrow through the outer coating of the egg. And that takes a good amount, or good normal amount of motility to kind of burrow through that coating. So, and they talk about maybe 20% of infertility as a male factor. Some people say 30%. Um, Unfortunately, we don't have a good functional test for sperm. We can look at the count and how they swim. But overall, when we do, patients are having intercourse or intrauterine insemination, we don't have a test a week later to know, did that egg really fertilize? Or if they had several eggs, how many of those fertilized and how long did they grow? Hopefully that technology will come along in the future. But right now, we could just evaluate the sperm under the microscope. Next slide. So again, just by way of introduction, I've been very grateful to be one of the senior reproductive immunologists here in Los Angeles. Most of the training has been here in Los Angeles, and I'm very grateful to be part of the science that's come into the field of fertility treatment. It wasn't too long ago, pregnancy rates were, less than 10 or 15%. Now with treatments, particularly with IVF, where you can look at the genetics of the embryo and transfer one embryo, the pregnancy rates could be 70 or 75% with one genetically balanced embryo. So looking at assisted reproductive technology, again, in vitro fertilization is so much part of that. And then transferring the embryo, I think the technology to be able to look at the lining of the uterus and with ultrasound, place the embryo in the center of the uterus has been very, very helpful. We know that a blastocyst, which I think in our laboratory with the embryoscope, allows that embryo to develop to that 100-cell stage. And that is when the genetic testing is performed. And, we know that intracellular sperm injection, ICSI, came into the field 20 years ago. It was very difficult, even with IVF patients, to have sperm fertilize the egg. Again, if they're low motility or abnormal shape, but with the introduction of and the technology to introduce one sperm into the egg to enhance fertilization was a huge step forward in terms of fertility treatment. Certainly donor sperm and donor egg programs are available. We can freeze embryos and sperm. And then here we have other fertility treatments for PCO, and we talked about infertility acupuncture to get the body in harmony. I think many of our patients that are getting ready to start fertility treatments or have a transfer in embryo to get the body in harmony, anything we could do to help that implantation process take forward is very good. Looks like we lost a slide here, sorry. Next slide, please. We also have a surrogacy program so that we can offer those services to all patients. So one of the first things we talked about in vitro fertilization, everybody asks, how long does it take? Basically in our program, once we have done all the testing and preparation, once a cycle or period starts, We go on birth control pills for about 2 weeks to quiet the ovary and to synchronize the follicles. And then we got an ultrasound, and if everything looks quiet with the ovary, then we stop the birth control pill. And then you start with injections of natural follicle stimulator. The only thing it does in the body is stimulate follicle growth. The follicles then make the woman's natural estrogen. Um, Again, high estrogen levels for multiple follicles. There's some bloating for a few days before retrieval. The retrieval is done with ultrasound. It takes about 15 to 20 minutes. It's done with a very light anesthetic called propofol. And most of the time, the woman is able to wake up and out the door within an hour, hour and a half. Tylenol is usually all that's needed for pain. So it's takes a while to do it. It's a little bit of a run up in terms of a program, but from start to finish, it's about 4 weeks. Have the period, go on pills for 2 weeks, about 2 weeks of stimulation, then retrieval. Then we grow the embryos and get the genetic testing about a week or so after that. And then the embryos can be transferred about 6 weeks after retrieval. Again, you have to let the ovary and the body recover from the stimulation. Next slide. So again, this just goes over the process, and you can see the needle go into the ovary. And actually the top of the probe to where the needle is just a few centimeters. And you can see on the right how those follicle sizes increased with stimulation. And that's important to do those 12 days of the injection, because you need a mature egg to be able to fertilize it and to retrieve it from the ovary. So unfortunately, that's kind of the 2 weeks of the injections. And we see an ultrasound and a blood test about every 2 to 3 days during that 12 days to again adjust the dosage and look for the maturity of the follicles. Next slide. So you can see on the left, this needle is, this is intracellular sperm injection. And again, the egg is microscopic. It's kind of like jelly. And you see the needle tip go into the surface or below the surface of this egg. And I don't know if you can see it, that one single sperm gives you one set of genetic material from the sperm and the egg, and it does not damage the egg. It's a very, very safe process, and it really enhances fertilization. So again, you can see on the right, like say the egg is like jelly, and it's a very safe process. Next slide. So here's a little video of a fertilized egg. It's 2, 4, 8 cells, 20 cells, and then at about 5 days, it's about 100 cells, and that's coming up pretty soon. And once you get to that 100 cell stage, the embryologist could take several cells to send for genetic testing, which is separate from the fetal cells, which is that little cluster right at the top. And again, biopsying embryos does not damage the embryo, but it allows for genetic testing. Not that you have to do that. You can transfer embryos fresh, but I think the vast majority of couples are electing for genetic testing because that drops the miscarriage rate from 15 to 20% down to 8%, because we can identify the embryos that are Down syndrome, the extra 21, or other small chromosome extras that cause miscarriage. An embryo that's missing a whole chromosome or duplicating a whole chromosome, you don't transfer those either because they do not produce a pregnancy. But a genetically balanced embryo that structurally looks like it does at the end, that implants probably 90% of the time, and then a successful pregnancy, 75% time, with maybe an 8% miscarriage. Next slide. I can't stop watching that. It's almost like a miracle. That's how we all started. So again, this just that's a diagram of how embryos develop, and on the right you see how they've taken several cells that they'll remove it from the embryo for biopsy. Next slide, please. They just took a few of those cells. And again, frozen embryo transfers are, most of the time we're doing what they call natural cycles. So we use a fertility medication called letrozole. And about 10 days later, we get an ultrasound and look to see where the ovulation is. And these embryos were frozen on day 5 or 6, and then we transfer after 5 days of progesterone. Next slide. And that's a very simple procedure, almost like a pap test, where the catheter just goes through the cervix and they put that little drop of fluid with the microscopic embryo in the uterus. But just other comments we know in terms of the male part of sexual health is many couples are really having infrequent sex because it becomes a chore. You know, tonight's the night, and the male partner's tired, and he has to perform. Many times, couples like to do intrauterine insemination. It takes some of the pressure off. We know that frequent ejaculation is used for men that have lower counts sometimes to give a better quality of sperm, to keep the sperm moving through the pipeline, essentially, because sperm are made every day. And there's studies that show that frequent ejaculations may improve the quality of the sperm. Again, some men have trouble with ejaculatory dysfunction, and we have men that sometimes need to take Cialis or Viagra. But as you mentioned before, I think the dialogue between the couple is really important. Struggling to get pregnant creates a lot of anger and fear, and is it ever going to work? It gives the opportunity for couples really to bond together in certain ways and discuss their sexuality and what works and what doesn't work, and but also not to stop having intercourse or sex altogether, because that's a part of sexual health also. All right, I guess we're at the end. We can
Yeah, I saw the question, how long can the eggs stay frozen? And we've had healthy babies from eggs frozen 14 years ago, but we encourage people to think about the frozen eggs within 10 years and give us a little window of time to prepare you to carry with those eggs. And the men need around 8 weeks to prepare their sperm so it can be as healthy as possible. And
yeah,
then
the length of time that you have frozen eggs doesn't diminish the genetics. They're still as healthy as when you first froze them. They're sort of suspended animation, which is amazing technology, sperm and egg.
yeah, and then I saw a question on, let's see. Yeah, I think you explained it, the PGTA, the genetic testing on the embryo and the pros and cons of that. And we have a lot of information regarding that. And when people have questions, we have a genetic counselor, Caroline, who's wonderful, who helps us tremendously to think it through for each individual patient as well.
Yeah, PGTA, which is looking for that extra or missing chromosome or pieces, has tremendously boosted the pregnancy rate. Again, when you transfer a fresh embryo untested, the pregnancy rate's what, 45, 50%. But once you transfer a tested embryo, it's almost 75%, with a miscarriage rate instead of 15 to 20 down to 8%. So genetic testing of embryos has been a huge advance in the treatment of fertility. And again, allows couples later on, if they have a boy the first time, you know the X and Y of all the embryos, so it can balance the family.
Yeah. Thank you, everybody. I hope you, oh, I saw there a question came in. Let's see. Oh, they're saying thank you for the information. We're happy to help in any way possible and sending good energy to everybody and hoping for the best.
And then there's a code for the webinar, 50% off the initial consultation. So again, if there's questions, if you think you may have some fertility issues, you've been trying for 6 months or longer, that's the time to have an evaluation and get a plan of what to go forward, what testing to do, or to try for a while longer. Can't hurt to do the evaluation. There's some testing you want to have Anyway, if you're thinking about being pregnant, genetic screen, looking at, again, we talked about thyroid and prolactin levels, blood count. Make sure you're ready and prepared for pregnancy. We check for things are changing. We want to make sure everyone has been immunized for rubella and varicella. Again, you don't want to get either of those infections when you're pregnant. So evaluations with a fertility specialist is a good thing. It helps to give you a plan, takes a lot of the stress out of the equation. Um, and that's part of the sexual health too.
Thank you, everybody.
And have a good rest of the afternoon. And again, we'd be happy to meet with you either in person or digitally. We do a lot of Zoom consultations. Nobody wants to drive in LA anymore, so I think that's a very easy way to initially meet with a doctor, fertility specialist particularly. So, thanks everybody for the afternoon.
Bye. Take care. Best wishes.